My name is Elizabeth Martikaruna and I am a registered nurse in the emergency department. I am looking after Jason Bilko, who is an 81-year-old male, born on the 1st of the 1st, 1937, with nil known allergies. His MRN is 123456 and he is admitted under Dr. Lance. The immediate clinical situation is that Jason Bilko was brought into the emergency department on the 3rd of the 9th, 2018 at 1600 hours, experiencing chest pain and dyspnea. On arrival, Mr. Bilko denied any chest pain, despite his noted vital signs presenting tachypnea at 32 breaths per minute and hypoxia at 82% on room air. Mr. Bilko's medical background history consists of unstable angina and previous admissions to hospitals for multiple falls. Therefore, a falls risk assessment management plan has been attended, and as a result, he is a high falls risk. I have ensured he has bed sensors and non-slippery socks in situ. After the ambulance officers handed over to me, I assessed Mr. Bilko's vital signs at 1620 hours. A clinical review was raised as he remained tachypneic at 28 breaths per minute and hypoxic at 88% on room air. I placed him on 6 liters of oxygen via a Hudson mask to improve his saturation. His other observations were within the flags as charted and documented. I completed an ECG and nil abnormalities were found after it was reviewed by Dr. Lance. I attached Mr. Bilko to a cardiac monitor, which is currently monitoring in sinus rhythm. Upon review, Dr. Lance ordered a chest X-ray, inserted an IV cannula, and took bloods. After Mr. Bilko returned from radiology, he was diagnosed with mild pulmonary edema. Mr. Bilko's care was then transferred to Dr. Turner. At 1645 hours, Mr. Bilko's vital signs were within the flags. At 1700 hours, IV fluids ordered for 0.9% sodium chloride 1000 milliliters was commenced and is currently running at 100 milliliters per hour as charted. At 1800 hours, I administered IV furosemide 40 milligrams as ordered. Post-medication administration, I took Mr. Bilko's vital signs and they all presented in the red zone. His clinical observations presented tachypneic at 33 breaths per minute, hypoxic at 84% on 6 liters of oxygen via a Hudson mask, hypertensive with a blood pressure of 180 over 95, a heart rate of 125 beats per minute, sinus tachycardic. A GCS was rousable only by pain, and a temperature of 35.7. I called for a MET call today on the 3rd of the 9th, 2018 at 18:05 hours and informed Dr. Turner today on the 3rd of the 9th, 2018 at 18:10 hours. I have stayed with Mr. Bilko while waiting for the MET team. So far, recommendation is to strictly monitor fluid input and output due to furosemide administration, as well as his diagnosis for mild pulmonary edema. Continue monitoring him due to being a high falls risk and ensure interventions are in situ. Continue close monitoring due to downfall trends in vital signs. Also awaiting pathology results. Thank you.